Hi, Dr. Winbush with Sankofa Healing Arts and Functional Medicine, here today to talk about a question that is important that we all get a handle on, which is what are the potential benefits of menopausal hormone therapy? And one reason that this question is important for all of us to have a handle on is that it is estimated by the year 2030 that half of the women and formerly menstruating people in this country are going to be postmenopausal. So if this issue doesn't affect you personally, it's very likely going to affect someone in your family or somebody that you care about. And so with that, let's start to talk about what are the indications for menopausal hormone therapy. And what we're talking about right now are what are the FDA, the Food and Drug Administration approved indications for menopausal hormone therapy. And what that just means is that when drugs or medications are approved by the FDA, they have certain indications that physicians and healthcare practitioners can write for, and that those are often the indications that may be covered by insurance. It doesn't mean that uh, there could be times when other reasons might be used to prescribe a medication, but these are the ones that are kind of held out as clearly having a lot of evidence and having the clear indication. So the FDA approved indications for menopausal hormone therapy are for the management of vasomotor symptoms, and we'll talk a little bit more about what those mean in just a moment, for the management of the genitourinary syndrome of menopause, for osteoporosis prevention, not treatment, and in the setting of premature menopause, especially due to what's called ovarian insufficiency. So let's unpack those a little bit more. So vasomotor symptoms are basically those things like hot flashes, night sweats. Actually, we don't talk about as much, but sometimes chills, kind of that temperature instability and the hot flashes and sweats that can go along with that. That can become very common in the lead up to menopause and in the postmenopausal period. And menopausal hormone therapy is very effective at treating those most of the time. As an integrative practitioner, I just want to say that there are other things that we want to do to kind of support overall health to make sure that both the hormones can work to the best of their ability and that there are not other conditions, maybe thyroid, maybe blood sugar, that are impacting those symptoms that someone's having. But basically, just staying focused here on talking about vasomotor symptoms and hormone therapy. We also know that going untreated, having uncontrolled symptoms, having really frequent hot flashes, having disrupted sleep from night sweats, is associated with an increased risk of heart disease. And there's probably a few different reasons for that that are interconnected. One of those being that having lots of hot flashes can often be a sign that there's actually some underlying blood vessel dysfunction that might put that person at increased cardiovascular disease risk. Uh, Also, if you have hot flashes, night sweats that are disrupting your sleep, that's likely going to increase your stress levels. We know that disrupted sleep can change things that are happening for you metabolically in terms of having more difficult to control blood sugars, maybe developing prediabetes, other conditions which in and of themselves will increase the risk for cardiovascular disease. So far, what we know is that one of the FDA approved indications and one of the ways that menopausal hormone therapy can be very effective is for controlling these vasomotor symptoms. The next is for genitourinary syndrome of menopause. What does that mean? Well, it's a catch-all term that refers to the vaginal symptoms, the dryness, the irritation, the thinning of the skin, and atrophy, the pain, urinary incontinence that can all accompany sometimes that transition to menopause, because the effect that estrogen has on those vaginal tissues, which is to keep them kind of plumped up, well nourished in terms of blood supply. As the estrogen levels fall, there's less of that effect. And these symptoms can be very bothersome, really impact people's quality of life, impact sexual health. And we know that topical estrogens, especially, are very effective. And what you also see there is that they're generally safe enough to the point that there's actually recognition now by a lot of oncologists, I won't say every, but that even in the setting, sometimes of breast cancer, when people are breast cancer survivors, in consultation with their oncologist, if they've tried other things and nothing seems to be helping, that low-dose estrogen therapy will often be approved, and it's been shown in most studies to be safe in terms of not posing any increased risk for breast cancer recurrence. So the next FDA indication is for osteoporosis prevention. So estrogen has an important role to play in kind of keeping that balance between bone breakdown and repair. And that's really common in all of our tissues. We don't think about that, but every day we're sort of turning over due to wear and tear, kind of getting rid of old cells and old tissues that need to be repaired and replaced, and laying down new cells and new tissues. And the same is true for bone. And estrogen is a really important part of that process. And so again, as estrogen levels are diminishing, as people enter and go through this menopausal transition, there becomes this imbalance where there is a higher rate of bone breakdown, and that can present as loss of bone density, bone thinning, at the extreme, obviously increased risk for or the development of fragility fractures, right? Like hip fractures, which we want to prevent. So there is clear benefit for the use of estrogen for osteoporosis prevention. The data is a bit less clear about really what it does for bone health and bone density if people have already progressed to osteoporosis, but we definitely know that estrogen is helpful for prevention. And that it also obviously is most beneficial if you're combining it with other lifestyle approaches and habits that are going to support your bone health, remaining active, definitely adding or continuing resistance training, weightlifting, and dietary choices, anti-inflammatory diets, et cetera, that are going to support bone health. And the nice thing, or the other consideration, is that when you use estrogen for bone protection and osteoporosis prevention, you're getting those potential other benefits from estrogen, which you would not necessarily be getting if you were just using a therapy for bone density, like a bisphosphonate type medication. And the final FDA-approved indication that I want to talk about is premature menopause, especially when it is related to the loss of ovarian function or the removal of the ovaries. And so the ovaries are where these sex hormones, the different forms of estrogen, progesterone, largely get made. And so if those are removed, you all of a sudden are having a very precipitous and significant decrease in the amounts of those hormones. And so obviously, oftentimes will lead to lots of symptoms. There are very small amounts of these hormones that are often made by the adrenal glands, right, which sit right on top of our kidneys. But what is known by looking at populations of people who have either entered menopause prematurely or had their ovaries removed for some type of surgical procedure, that there is an increased risk of developing cognitive decline, cardiovascular disease, osteoporosis, for some of those reasons that we just talked about. And so there's a very clear indication for, and I wrote here MHT, it actually would be hormone replacement therapy. If people are not at the age of menopause, you're actually going to replace your hormones at a higher level than you would if somebody were already in menopause, because you're actually trying to duplicate what they would be making on their own. And again, this might be getting outside of the scope of this talk. A lot of times what is used for that hormone replacement in younger people at higher doses are not bioidentical hormones, but higher doses perhaps of birth control pills, et cetera. And before we leave this talk about the potential benefits of menopausal hormone therapy, I just covered what are a lot of the, or what are the FDA-approved indications. But we also want to note that there are other potential benefits for improvements and stabilization of mood and depression and anxiety symptoms that can sometimes become more present during the menopausal transition. There's the cardiovascular disease protection benefits that we have seen in a lot of studies. especially when we look at bioidentical forms of hormone therapy. There are potential benefits for the improvements in cognitive health. Not every study has shown that. And, some of these, there obviously are studies that are continuing to be done to kind of refine this. But in younger women, younger people who are closer to the age of menopause, there does seem to be a clear signal for cognitive health benefits, as well as significant disease prevention with diabetes, decreases in overall death rates, decreases in all-cause mortality, and improvements in sexual health. Some of that could be through the effects of estrogen that we just spoke about on the vaginal tissues. And then there are also potential benefits from things like testosterone and DHEA, which are other hormones. And I will say, though, that we don't have, for instance, a FDA approved testosterone for use in women. So some of those would then be getting into the territory of looking at custom formulations or compounded applications for those. But hopefully that gives you just a brief overview of what some of the potential benefits of menopausal hormone therapy are. And if you have questions, feel free to leave a comment.